Side effects of birth control pills. Birth control pills work by preventing ovulation. No egg is made, therefore there's nothing for the gamete to fertilize. Pregnancy cannot occur. The pill is employed by nearly 16% of girls aged 15 to 44 years within us, and its each blessing and drawbacks. People with totally different risk factors is also suggested to use a specific reasonably pill. There are different types of contraceptive pills. They all contain artificial types of the hormones estrogen, progesterone, or both. Synthetic progesterone is called progestin. Combination pills contain progestin and estrogen. The mini pill contains only progestin. Here are 10 side effects of birth control pills. 1. Intermenstrual spotting. Breakthrough vaginal bleeding is common between expected periods. This typically resolves among 3 months of getting down to take the pill. During recognizing, the pill is still effective as long as it has been taken correctly and no doses are missed. Any one UN agency experiences 5 or a lot of days of hemorrhage, whereas on active pills, or heavy bleeding for 3 or more days, should contact a healthcare professional for advice. This hemorrhage might happen as a result of the womb as adjusting to having an agent mucous membrane lining, or as a result of the body as adjusting to having totally different levels of hormones. 2. Nausea. Some people experience mild nausea when first taking the pill, but symptoms usually subside after a while. Taking the pill with food or at hour might facilitate. If nausea is severe or persists for extended than 3 months, you should seek medical guidance. 3. Breast tenderness. Birth control pills might cause breast enlargement or tenderness. This unremarkably resolves a couple of weeks when beginning the pill. Any one UN agency finds a lump within the breast or UN agency has persistent pain or tenderness or severe breast pain ought to obtain medical facilitate. Tips for relieving breast tenderness: embrace reducing caffeine and salt intake and sporting an ancillary undergarment. 4. Headaches and migraine. The hormones in contraception pills will increase the possibility of headaches and sick headache. Pills with differing types and doses of internal secretion might trigger totally different symptoms. Using a low-dose pill might cut back the incidence of headaches. Symptoms unremarkably improve over time, but if severe headaches start when you begin taking the pill, you should seek medical advice. 5. Weight gain. Clinical studies haven't found the same link between the utilization of contraception pills and weight fluctuations. However, fluid retention might occur, particularly around the breasts and hips. According to one review, most studies have found an average weight gain of under 4.4 pounds 2 kilograms at 6 or 12 months with progestin-only birth control. Studies of other birth control methods showed the same gain. Some varieties of secretion contraceptive are joined to a decrease in lean body mass. 6. Mood changes. Studies counsel that oral contraceptives might have an effect on the user's mood and increase the chance of depression or different emotional changes. Anyone experiencing mood changes throughout pill use ought to contact their medical supplier. 7. Missed periods. Even with correct pill use, an amount might typically be lost. Factors that may influence this embrace stress, illness, travel, and hormonal or thyroid abnormalities. If the amount is lost or is incredibly lightweight, whereas mistreatment the pill, a pregnancy test is recommended before starting the next pack. It is common for a flow to be a flare or lost altogether now and again. If concerned, seek medical advice. 8. Decreased libido. The internal secretion or hormones within the preventative will have an effect on drive or concupiscence in some individuals. If weakened concupiscence persists and is pestiferous, this should be discussed with a medical provider. In some cases, the birth control pill can increase libido, for example, by removing concerns about pregnancy and reducing the painful symptoms of menstrual cramping, premenstrual syndrome, endometriosis, and uterine fibroids. 9. Vaginal discharge. Changes in emission might occur once taking the pill. This may be a rise or a decrease in epithelial duct lubrication or modification within the nature of the discharge. If epithelial duct condition results, added lubrication can help make sex more comfortable. These changes aren't typically harmful, but alternations in color or odor could indicate an infection. Any one UN agency regarding worries is bothered about such changes ought to speak with their medical supplier. 10. Eye changes. Hormonal changes caused by the contraception pill are joined to a thickening of the tissue layer within the eyes. Oral contraceptive use has not been related to a better risk of disease, but it may mean that contact lenses no longer fit comfortably. Contact lens wearers ought to consult their eye doctor if they experience any changes in vision or lens tolerance throughout pill use.